more. But that is where we are today with respect to the Pathways to Coverage 1115 waiver. Any questions from the group?
This is Laura Colbert with GHF. Apologies for always having a question or comment about the waivers. More a comment today than a question. I know that you know, the work requirements is probably a sticking point, and I would encourage the Department of Community Health as well as CMS to look at Montana's work program. It's voluntary, and they've had some really great results from it. So maybe that is a starting place for a mutually agreeable path forward.
Yep, absolutely. And I appreciate that feedback. So again, we'll keep the group posted. Thanks, Laura. Okay, next slide. Our next 1115 waiver is the postpartum extension. So this was slated to be implemented on July 1st of this year. As you guys know, we did get approval from CMS early on this year. So we're in a kind of an interesting place with the postpartum extension. So as you all are aware, because of the public health emergency, we have not terminated any members since March of 2020, with certain limited exceptions. So our pregnant women are on and enrolled. Those who have delivered continue to be on and enrolled because we have not terminated them. And so they're continuing to receive services under pregnancy Medicaid, really at this point, just by virtue of the public health emergency. And so as we enroll new and bring on new pregnant moms, it's the same scenario. They're enrolled in pregnancy Medicaid. And then after the first 60 days, they will shift over to the 1115 waiver and continue to receive services. So we're continuing to work with CMS just on some outstanding deliverables. And those are mostly around reporting requirements that CMS requires. And so we're working with them, having at least monthly conference calls with them on those deliverables. So hopefully we'll be bringing those to a close soon. And then, of course, our managed care entities are providing the extended services, which is up to 6 months. So if you all will recall, prior to us getting approval on the 1115 waiver, our pregnant women could only receive 60 days of postpartum services after the date of the delivery. So through this waiver, we have extended postpartum services for an additional 4 months. Thus now our mothers will receive a total of 6 months of postpartum services. And so overall, it's going well. Our care management organizations are working with our moms just to make sure that they're receiving all of the services. Any questions on the postpartum extension waiver?
Lynette, I do. Because of the continuous coverage that pregnant women and new moms now are getting through this waiver because of the public health emergency, it seems like maybe a pretty unique opportunity to look at, like, are there better outcomes when they get this, you know, maybe year of coverage versus, you know, the 60 days. So is that something DCH is looking at doing?
Yeah, that'll be part of the, you know, the reporting and the overall hypothesis, right? And the purpose and the goal of the waiver. So yes, those are things that we will be monitoring.
Thank you.
And Lynette, this is Kelvin, if I can interject on that as well.
Sure, absolutely.
You're right. This is a unique opportunity for us to take a look at moms that in some instances now that have had 12 months or 12 months plus, if indeed, if there's enough strength in terms of if their outcomes might be different from what some baseline period. So I think that is something that I think we know we need to look at, and we hope to be able to do so, just as Lynette mentioned.
Yep, and I think one other thing that I'll add, and you know, kind of indirectly related, Laura, is that under the American Rescue Plan Act, states will soon have the opportunity to move to 12 months postpartum services under the state plan. And so that's something that we're considering as well. And so I do think it'll be interesting to see overall the findings, during this and the results of the moms being on during the PHE. And that may help to kind of guide our next steps in terms of whether we opt to take advantage of the ARPA provisions. Next slide, Demetrius. All right, wanted to take a few minutes to talk about the upcoming Georgia Families and Georgia Families 360 procurement. And so before I go down this path, I'm in a position where I have to give this disclaimer, and that is I have to be limited. We, as the state agency, have to be limited in terms of what we share regarding the procurement. Our care management organizations are a part of, the Medical Care Advisory Committee. They participate on these calls and the quarterly meetings. And so we don't want to find ourselves in a position where we are giving them an unfair advantage, as I am certain that each of our care management organizations will want to bid on the upcoming RFP. So because of that, you will find that our reports and updates as it relates to the RFP and the next procurement are very high level, very, very high level. However, if you want to have, an offline discussion and get into more details or give recommendations or ask questions, we are always available and willing to do so. But because our CMOs are at the table, we just have to proceed cautiously. So with that stated, I'll give you a few updates on where we are. Again, these are high level. The first is that we are onboarding a consultant to help with this work. We've identified a consultant. We're finalizing our business associate agreements and some other documents with them currently. And then hopefully once all of that is done, then we can start sharing data with them and moving down the path of RFP development. The first step in the process will be to have our consultant to do a comprehensive statewide and national environmental analysis. And this is to identify best practice, innovations, and designs that we can consider for inclusion in the upcoming RFP. So that's going to be step number one that they are going to do. The next step is going to involve stakeholder engagement. So we will be reaching out to our stakeholders, our sister agencies, our provider associations, the Medical Care Advisory Committee, and even the CMOs will have an opportunity to give some feedback and thoughts, on what could or should be included in the next RFP. So I just want to assure you that there will be a significant amount of time and a significant period spent on engaging our stakeholders. So we want to make sure that everybody has an opportunity to give their recommendations. Thereafter, we will move into the stage of RFP development and contract development. And of course, there's quite a bit that goes along with that. And then ultimately plan to put this forward for competitive bidding. So it will be released for those who are interested in actually submitting a response and a bid on the RFP. In terms of timeline, we are still working through that right now. I don't know when the RFP will be released. That's something that we'll have to work through more with our consultant, as well as our commissioner and the governor's office. So we'll keep you all posted. Next slide. Any questions in that area? Okay, hearing none, I'll move on to give a few updates on the federal public health emergency. So for those of you who are not aware, on July the 19th, the Secretary did extend the public health emergency for another 90 days. So that will carry us through mid-October. As I mentioned previously, the Department of Health and Human Services sent a letter to all of the nation's governors indicating that the public health emergency was most likely going to run through the end of the calendar year. And so, I'm sure at this point, with the current status and the numbers increasing, it may extend even beyond that point in time. I think we all just have to wait and see how things are going to play out. But officially, the public health emergency has been extended for another 90 days. The second thing I wanted to mention is the COVID-19 vaccine is the third dose. So we are preparing to update our systems right now so that we will be able to reimburse providers for the booster dose for COVID-19. The reimbursement rate will be the same as the first two doses, which is $40. We're hoping to move out a banner message and updates today. I'll circle back with our director of pharmacy on that, but I think we're slated to roll all of those out today. So providers will be aware, of the fact that they can now bill and get reimbursed for the third dose for the vaccine. So wanted to make sure that you all were aware of that. You may have heard on the news recently that we are also going to be assisting our Georgia hospitals with additional staffing. So this is not something that's new. We've been doing this and been providing assistance really since the start of the public health emergency. So we've identified a number of hospitals where we will be assisting with additional staffing to include physicians, nurse practitioners, respiratory therapists or other practitioner types that are needed. So that work will be ongoing. The third thing that I wanted to spend a little bit of time on is the recent guidance that CMS issued on this past Friday, August the 13th. And they issued some guidance on resuming normal operations. And the guidance was specifically to address some changes regarding all of the annual redeterminations that have been put on hold, as well as all of the other eligibility and enrollment actions that are pending. In the recent guidance, CMS is now giving states up to 12 months after the month in which the PHE ends to complete all of the pending eligibility and enrollment actions. So, this is great news, nationwide for all of the states. We currently have approximately 750,000 annual redeterminations and renewals that have been put on hold. So I'm certain that we will use, if not all, most of this 12 months in order to get those completed. Next slide. We are working with the Department of Family and Children Services, or the Division of Family and Children Services, on outlining the plan. Now that we have this new guidance from CMS, we engaged them yesterday, actually, to start talking about our approach after the PHE ends and how we're going to handle all of the annual redetermination. So I'll keep you posted on that work, but just want you to know that we did recently engage DFACS around this issue. In addition to extending the time period to 12 months, CMS also indicated that states must resume the timely processing of applications 4 months after the month in which the PHE ends. So that's something that we're going to include in our plans. They were clear that states must complete an additional redetermination prior to taking an adverse action. And the whole point of this is to avoid and to prevent erroneous member terminations. So during the PHE, we've been doing the work on the back end in terms of change of circumstances and reviewing information that's come in. But what CMS is requiring here, what they're saying, is that states, you can't just rely on the reviews that you did during the PHE. You're going to have to do an additional redetermination review prior to taking an adverse action. We also have to give the members or the beneficiaries reasonable time in which to respond to notices. Our notices must inform the members of their rights to appeal. So due process rights and hearing rights must be provided. And we are also required to take steps to transition terminated individuals to other insurance affordability programs. And so we do this today. So when we terminate individuals today, what we do is a referral to the marketplace to see if they are potentially eligible for any of the insurance products on the marketplace. And then the last notice or point that CMS made to the states was that states should end any flexibilities that are no longer needed. So this has to do more so with all of the temporary policies that were put in place as a result of the public health emergency. And so we are reviewing those internally at this time. We have not made any firm decisions at this time on whether or not we're going to end any flexibilities or which ones we would choose to move forward with rolling back. So we'll have to have ongoing discussions on that point. So I'll pause there. Any questions regarding the updates on the federal public health emergency? Okay, next slide. All right, I want to shift to the WellCare Peach State integration and merger. I think at our last meeting, we reported out that we were working on the merger date of May the 1st. I am pleased to report that we made it successfully and the merger went off pretty well. It's been very quiet. I think overall, the members are satisfied as well as the providers. I wanted to give you a picture of where we are today in terms of enrollment, because I do think you should be aware of where the numbers are. So two of our largest CMOs merged on May the 1st, that being WellCare and Peach State. And so naturally, as a result of that merger and integration, they're going to be the largest plan. But as of August the 1st, our total CMO enrollment is 1.8 million members. And when you look at the breakout below, you'll see that Peach State Health Plan, as of August the 1st, had 944,000 members. So that is significant. That enrollment is very large. So we will be monitoring closely just to make sure that everything continues to go well, but just thought that you would want to see kind of where we are today as a result of the merger. Any questions? Okay, next slide. Wanted to talk about the home and community-based initial spending plan. So for those of you who are not aware, Section 9817 of the American Rescue Plan Act provides states with an opportunity to access additional funding for home and community-based services. CMS was clear that in order to access the additional funding, you had to use it to enhance, expand, and strengthen home and community-based services. So in other words, you could not use this funding to supplant your existing state funds today. We did submit our initial spending plan on July the 12th. It is still pending CMS approval. We actually reached out a few days ago to see where they were in the process. So they did inform us that they're still completing their reviews. So we'll keep you posted. But I wanted to outline for you the initiatives that we presented in the initial spending plan. The first was to develop a case management technology platform. The second was to enhance our critical incident management process to include comprehensive reporting and dashboarding. Next slide. We wanted to expand home and community-based services to include behavior aids for children diagnosed with autism. And that's because we have gotten a significant number of requests and demands to provide behavioral aids for those with autism. So that was the basis for this particular request. We want to expand the use of technology to deliver home and community-based services. We had quite a few requests for payment rate enhancements and a rate study for 1915C waivers. Workforce development and training was also one of our requests. We wanted to do an assessment and study of our current home and community-based services workforce and retention, recruitment, and development, as well as a supported employment pilot program. So the key takeaway here is that this is an initial spending plan. We do have the right, per the provisions and guidance provided by CMS, to make adjustments at our quarterly updates. So we are having discussions internally now on next steps. One of the key things that we had to consider in terms of the initiatives that we wanted to move forward with was sustainability. So per the guidance provided by CMS, states have to be able to demonstrate that they can sustain these changes that they are making once the funding ends, because the funding is only available for a limited period of time. So we have to be able to demonstrate that we can sustain the initiatives that we're putting forward. So that does help to kind of guide what it is that we're wanting to move forward with. And of course, we have to make sure that we have the support from OPB in terms of funding. So we are going to be looking at our next quarterly, update, and whether or not we want to make any changes. And if we do, what are those changes? Again, we have to have further internal discussions. And more importantly, we're still waiting to hear back from CMS on our initial spending plan. In my conversations with the Medicaid directors in the South region, for those who have received a response from CMS, what we're finding is that they're requesting additional information from the states. So in many instances, they're not granting approvals. They're sending out requests for additional information, or in some instances, partial approvals. So we'll wait to see what we get back. And we'll go from there and keep you all posted. And I think, Demetrius, that concludes the presentation. So I'll open it up for questions and answers.
Anyone have any questions for Lynette?
All right, thank you, Dr. Sukas.
Thank you, Lynette. I really appreciate you providing that update. Very informative. And as usual, you guys have lots of great things, exciting things happening in your world. So thank you for that.
Yep, thank you.
Next on our agenda is on continuous glucose monitoring value analysis update. Dr. Holloway, did you want to open that up?
Sure. I'll be happy to open this up, and then I'll turn it over to Carla Willis, our Director of Performance Quality Outcomes. We shared at our last MAC meeting in the second quarter that we would undertake a value analysis of the expanding or utilizing continuous glucose monitors, be it for our beneficiaries. That work has begun, and I wanted Carla at least to provide a kind of update of where that endeavor is and where the next steps would be. So Carla, I'll turn that over to you.
All right, thank you. So we wanted to kind of give you a list of what we've completed, and then give you some type of a sense about the things that we still have to complete. So on our completed list, we have taken a lot of time to review the acts from the presenters. And they did a really good job of providing a sufficient amount of information to get us started. We did establish an internal working group comprised of all parties with relevant information on this topic. We asked and received and also reviewed all of the continuous glucose monitoring policies from our CMOs. And we kind of juxtaposed that with the policies for our fee-for-service population. Next, we reviewed utilization trends from the CMOs. We then established some estimates of the members who are diagnosed with type 1, type 2, and gestational diabetes per the policies for our fee-for-service population and our CMOs. We then reviewed the literature for links between continuous glucose monitoring and outcomes, both those that are kind of like your traditional outcomes, anything related to like ED use, inpatient hospitalization and others. But we also wanted to include a quality of life metric. So we're taking a holistic approach to determining whether or not kind of upticks in utilization for continuous glucose monitoring is associated with a range of outcomes. So some of the things that we have left to complete, we are continuing to convene our internal work group. I'm trying to admit someone here. Next, we have a series of uptake scenarios given member data that we have received. From there, we'll take all of that information and bring in our finance team to conduct a cost estimate. And then we'll use all of that information, compile it all together, and draft some recommendations given all of the aforementioned components. So it is our hope that we will be in a good position to share our recommendations and our completed review by the next MCAC meeting.
Thank you, Carla. I don't know if there were any questions for Carla or us.
I just want to cheers Carla and her team for the performance dashboard, which is not part of this presentation, but the quality performance dashboard looks great. So cheers to you guys.
Thank you so much. Thank you, Dr. Sukas.
Okay, thank you. I think next on the agenda, announcements and information. So Dr. Holloway, do you want to take that away?
I will. I guess just segue in to make you aware, if you're not, the 2020 Quality Performance Dashboard is live. It's on our DCH website. If you haven't viewed it, I encourage you to take a look. We are proud of it. We certainly can tweak it as we move along with feedback, but certainly take a look at it if you have an opportunity to. And secondly, the Planning for Healthy Babies public forum was afforded for public comment on our most recent reporting period to CMS. That was from July through December of last year, 2020. We didn't receive any questions or comments, but at least wanted this committee to be aware of that period was and that opportunity was afforded. That's the only announcement that I had, Dr. Sukas.
Okay, thank you, sir. Does anyone else have anything else that they would like to bring up? Any questions or comments? Okay, our next Medical Care Advisory Committee meeting will be on November 17th. So you'll be hearing more about that. And if there are no further comments, we will adjourn the meeting. Thank you all for participation. We appreciate your involvement. Have a good day.
Thank you.
Thank you. just come in. I can't. Away.